Hello, Concord providers. This is Dr. John Jones, Chief Medical Officer with Concord Medical Group. We'll take a brief moment today to talk about EMTALA, the Emergency Medical Treatment and Active Labor Act, which was enacted by Congress in 1986. The act was put into place so that everyone could access emergency care and have access to that care when needed. Recently, a Supreme Court decision has increased awareness of EMTALA and has made it easier for patients to file complaints when they think their EMTALA rights have been violated. With that in mind, I just want to talk about what EMTALA encompasses and what it requires of us as providers. And we want to make this a very basic talk. This is not going to be in depth. There are going to be a lot of things which you may have questions about, but we're going to hit on the basics today. EMTALA requires basically three things from us as providers. The first is a medical screening exam. The medical screening exam is to be applied to anyone seeking care at the hospital or anyone within 250 yards of the hospital who may need medical care has the right to emergency services at that location. That's every patient. Whether you have the resources to complete their care or not, they deserve a medical screening exam at your facility. The medical screening exam may include just a history and physical. It may be as simple as that. It may also require lab and radiology evaluation. It may even require the need for consultation from specialists in order to determine whether an emergency medical condition exists. The purpose of the medical screening examination is to determine whether or not an emergency medical condition exists. If one does, that then takes us to step 2 of EMTALA. The second requirement of EMTALA is stabilization. When you determine that an emergency medical condition exists, we must stabilize the patient within the resources of the facility that we're in. We must do the best with our resources to stabilize that patient. And stabilization means getting the patient to a point where there would be no material deterioration in their condition should they be transferred to another facility. So we must do the best we can to stabilize those patients. Sometimes patients will exceed our resources. And when that's the case, step 3 of EMTALA comes into place, and that is an appropriate transfer. An appropriate transfer has several different requirements. The first is that the patient has been granted a medical screening exam at your facility, that they have been adequately stabilized within the confines of your resources, and then that transfer can take place. The transfer must be enacted after agreement with the receiving facility. It requires acceptance by the medical personnel and the administrative personnel at the receiving facility. It must also be documented well, and usually that is in the form of a memorandum of transfer or an MOT. That MOT must include patient information, the diagnosis of the patient, and then also the time and date that acceptance was gained from the facility that the patient is being sent to. It also requires a signature by you, the provider, who will be transferring the patient to the tertiary facility. The other requirements of the appropriate transfer includes that the patient must have care en route to the tertiary facility. They must have continuing care by medical personnel as they make the trip to the tertiary facility. And then finally, the appropriate transfer includes sending copies of the medical record, including any imaging that's been done at your facility, to the receiving facility. EMTALA can be pretty complex at times, but we want to simplify it as best we can. And if you'll do these 3 things, we'll be successful in meeting the requirements of EMTALA. First, the medical screening examination. Remember, every patient that presents to your facility must have a medical screening examination. You cannot turn those patients away. Second, any patient that's determined to have an emergency medical condition based on your medical screening examination must be stabilized within the confines of your facility and its resources. And then third, if the patient exceeds the resources of your facility, an appropriate transfer must be made. And the appropriate transfer requires all of those elements we talked about earlier. EMTALA is in place for a very important reason. Everyone should have access to emergency care. We want to make sure that we provide it correctly and that we follow the rules of EMTALA as they've been put in front of us. Thank you for all the work that you do for Concord. Thank you for your time today and listening to this recording. Hope you have a great day.